second since I've had the surgery feeling like I want to eat something and I couldn't eat it.
Yeah, you know.
I mean, that just
but
doesn't happen.
I didn't believe Dr. Rutledge when he said if you had the surgery that your taste would change. Like, what are you doing to my mouth? There's no way that my taste will change, and believe me, they change.
It does.
I absolutely adore salads, and you know, it's like every meal I just have a salad.
Isn't that wild? In other words, people say, "Did you play some kind of strange audio tape and make my taste change?"
Yeah, it's
okay,
true.
but now.
No, you know what? And that's the nice thing about this. I've never felt hungry. Never from the day of surgery. I know you have to eat, but you never feel hungry.
Now, how can that be? How can that? Do I like brainwash all these people? And other post-ops? Is that right? Is she telling the truth? Is that right? Dawn?
Absolutely, yeah.
Dawn? Now, Dawn is very reticent. He wouldn't speak up unless I asked him, right? Because you're real quiet, retiring kind of person.
Yeah.
That's what everybody tells me about you. Is that right, Dawn? Oh, Dawn had a stricture. Yeah, you had a stricture,
I
right?
had a stubborn one.
Yeah.
Four times it took.
Yeah, he had 4 dilations, right? All my strictures come back to clinic. Though.
Yeah, there you go.
I should have brought Paul, my neighbor, with me tonight, too. Did you know Paul was my neighbor?
No. Doing okay?
Yeah, she's fine.
Good. But after surgery, you're not hungry.
Why?
Everybody together. Why are you not hungry after surgery?
Greenland. That's right.
What?
What?
Greenland.
Greenland.
You'll know Greenland by the end of tonight.
Yeah.
Greenland.
Grelin. Grelin is the hunger hormone.
Okay.
Okay? And before surgery, the hunger hormone in heavy people is very high. And you're constantly fighting it. And after surgery, the ghrelin hormone comes out of the lining of the stomach. And we cut through the stomach and the vagus nerve to the stomach, serum measured ghrelin levels go down. So these people are telling you a paradoxical story. You can eat about a quarter of what you used to eat. Is that right?
Yeah.
Yeah, probably less.
Less than a quarter of what they used to eat. Yet they're telling you they're more satisfied and less hungry. How can that be?
Absolutely.
The answer is ghrelin. Now let's suppose we gave them a lap band. That's the other good choice. Lap band does not decrease ghrelin. And if you talk to a lap band patient, they may be losing weight. They're not happy in many cases because they're hungry and they want to eat because their ghrelin levels go up. They're hungry, they want to eat, they run into that tight, narrow band and they vomit and have trouble, and it's not a fun thing to live with. It's different than the gastric bypass. The gastric bypass causes a drop in the serum hunger hormone level. And so all these people are eating less or a quarter or a third of what they used to eat, yet they're smiling at me. If I put you in prison and gave you a quarter of what you used to eat, you wouldn't smile at me.
No.
Right? And so what we do is something changes internally, and that's what's so exciting about this.
Yeah.
Let me just tell you, when I had the surgery, prior to surgery, my breakfast, this is the God's honest truth, you won't believe it. I mean, I can't believe it now either. This was in the form of breakfast sandwiches, but I had 3 bagels, slathered in butter, 2 eggs on each sandwich, so that's 6 eggs, 2 pieces of cheese on it, that's 6 pieces of cheese, and 6 pieces of bacon on each sandwich, that's 18 pieces of bacon. Some home fried potatoes, but I had a Diet Coke. Diet Coke.
I'll have 2 Big Macs and a Diet Coke.
Now I'll have 1 egg, a little bit of cheese, and either a sausage patty or a couple pieces of bacon, and I am stuffed. Stuffed.
And satisfied and happy?
Oh,
Or
thrilled.
you feel like, oh
Sure.
gosh, I wish I could have those 6 bagels?
No.
And now how
No.
can that be? You know, now I have to tell you, I paid these people to come and
Yeah.
say this.
No, we got pictures to prove you don't.
That's
That's true.
And where is that box of money that you're saving from not eating? so
She's
much?
wearing it.
Oh,
You do not save money now. You do not save money on this operation
That's
because
right.
you more than spend it on clothes.
no doubt about
agree
it.
with that.
And shoes.
Oh yeah, I mean,
I had 2
let me
pair,
prove
now I
that.
have 15, okay.
Yeah. That's
Yeah.
living proof.
Right. So you don't save any money.
Did you notice any other different feelings as far as as different hormone levels? Does your hormone levels align?
Oh, yeah, we're going to talk a lot.
I was gonna say-
we have our
I didn't honestly have any problems whatsoever.
right. We have people here who actually can speak to that. We'll have we have some people to talk about that.
Truly, Teresa, honestly, I mean, I had the stricture. I still have a problem. I mean, I've got to tell you now, this is the first
That's okay.
time
I'll edit this out. Yeah.
is that when I get excited, like if I'm at a football game or something, and I get excited, I just seem to have a little acid churn up, where I've got to bring the acid up.
Okay. If that happens,
very
that's
small problem.
but you could have a little bit of an ulcer there, and we should
Really?
talk. Yeah, because you shouldn't have that. If you get that, that can be a sign of a little bit of an early ulcer, and you're taking the protonics. But sometimes we have to give you a course of higher dose antacids.
Oh, okay.
So after we're done,
Absolutely.
let's call me or stop by one day, and
glad
we'll
I did
spend some
bring it
time. Yeah.
Come over for dinner.
Yeah.
Yeah.
But truly, Teresa has had
No problem.
unbelievably zero problems.
Nope.
Yeah.
I was just going to ask about the stricture. How did it get worse over time, or did you all of a sudden realize that you were unable to swallow, or?
I think
did
it
even
probably
appear?
got worse because I could eat, less and less and less to the point where I couldn't eat anything. And this fella here could probably tell you better than me, but
It was about a week or so post-op. He couldn't even take liquids.
Right.
And so we sent him to the endoscopist, the gastroenterologist, Dr. Mahendra D. Fonseca. He looked in there, saw it was tight, and put a little balloon in, opened it up a bit for us. And then, did you have to have more than one, 2 or 3
I had
visits?
two. I had two. But it was a zero deal. I mean, you were in and out.
In other words, this surgery can have complications, and there are terrible complications. We don't like it, but it's usually easy to fix and usually easy to deal with. Yeah, but that's one of the well-recognized complications. We get it about 1 in 100 of our patients. We've done, I think it's close to 700 people here in Las Vegas, and my entire series is 3,743 people. So we have a large experience of people, and we get some strictures, and usually it's very easy to fix.
Did your doctor support you?
Oh, yeah.
Do they
They did.
understand, like if you have different needs now? Can they address them
Our
together?
doctor now just can't believe it. I mean, think about it. Doctors don't. I mean, I was one of the worst patients. You talk about a non-compliant patient. I mean, he hated me. I walk into the doctor now, and he sees her and he sees me. He just can't believe it. He's so happy
Who's your doctor?
when he sees it.
Sheldon Mike.
Sheldon Mike.
Oh, yeah, right. Good. So he's happy?
Oh,
he
he said
can't
he's never
believe
seen
it.
results like this.
Yeah.
He takes our picture. Every time I show him
He
pictures,
does.
he takes them.
He takes
Nope,
it and
hold
puts,
on, Bo.
and,
Yeah, put 'em
puts
in
it
the
in the
file.
chart.
Yeah, just-
Absolutely can't believe it. He says he just doesn't see it. He just doesn't see it.
no. Yeah, very supportive.
Yeah.
Have you had trouble with excess skin?
Oh, nothing that clothes can't hide.
Yeah.
Okay.
Well, that's
Sure,
true.
sure.
Because they've lost tremendous amount of weight.
Yeah, I was
Right,
going to
so-
say if I took off the jacket, I got some nice fat wings. So,
Okay.
but, I can live with it.
Sure, covered.
Yeah.
Yep.
Well, and that's the thing, if you, depending on how old you are and how much weight you lose, there's more or less of that extra skin. Some people are blessed and they have stretchier skin and so it snaps back. Other people, if you lose, close to 200 pounds, that's like having 2 people get out from underneath the covers, There's
Yes. That's
You know?
right. That's exactly it.
But my skin's doing much, much better than hers.
Yeah.
And that's
Much,
just
Very
much
wrinkly,
better
and
than
he's
hers.
so much older than I am.
Yeah.
It's just difference in how much elastin. Each of us, if you look around the room, each of us is different, and the elastin in the skin is different. And some people snap back, and other people have a lot of extra skin.
Yeah, shorts will not be my friend any longer.
Right. Well, yeah.
Christine
That's a
just
small
got
price.
She says, oh, I have my share.
Is that right? Really?
I do.
You look stunning.
Thank you.
All right.
Okay.
Thank you very much.
Thank you.
Hey.